Welcome to this options video for psychology. Hopefully after watching this video you can learn about what psychology is, and you'll also be learning how it's assessed. Psychology is a popular subject and it has good links to many of your other subjects. It also links well to real-world situations and may have relevant links to things that you see in the news. So psychology is probably a new subject for you, and it is the scientific study of the human mind, brain, and behaviour. So what we'll be looking at is the causes of our behaviours. An important thing to note about psychology is that research is still being done today. It's still a relevant subject. We'll also learn how psychology can help to inform our day-to-day lives. And often it's very relevant in medical treatments of certain mental illnesses. And you'll be learning how we can use psychology as a treatment. In the first year, you'll be studying 2 units. Unit 1 serves as a good introduction to psychology. You'll be looking at 5 different approaches, and each one is a different viewpoint within psychology. So the first approach we have is the biological approach. And you'll be looking at things like Darwin and evolution, which you may have already looked at in your biology classes at GCSE level. We'll be able to see how behaviour changes over time. We also get to look at brain function and neurotransmitters, so we can see how different parts of the brain are responsible for different actions, and what different chemicals or neurotransmitters do in the brain. We also look at different kinds of therapies when we do the approaches, and with each approach there are 2 therapies that your tutor can choose between. So with the biological approach, you may be looking at drug therapy. So things like antipsychotic drugs. Or you could be looking at psychosurgery. So medical interventions on the brain. You then move on to the cognitive approach. So cognitive approach is all about information processing, and often people in the cognitive approach would describe the brain as working like a computer. So we can look at the different processes in the mind, so things like memory and perception. And we'd be looking at how people might interpret the world differently, which might be based on their schemas. So schemas are packets of information that people may have about the world. Importantly to cognitive approach, we also look at things like eyewitness testimony. There's a key study in this area by Loftus and Palmer, who look at how our memory can be influenced. So how can leading questions physically change our memory? In addition to this, in the cognitive approach, you'll likely look at CBT, so cognitive behavioural therapy. This is a very common therapy, and in fact it's the most common talking therapy used by the NHS currently. Then you'll be looking at the psychodynamic approach. So psychodynamic approach may be your stereotypical view of psychology. So if you've seen a psychologist on the TV or in a movie with the therapist and the patient lying on the couch telling them about their childhood, this is probably based on the psychodynamic approach. So the psychodynamic approach was started by a man called Freud, and it looks at how a personality can be informed by our childhood experiences and how a lot of our thoughts are stored in our unconscious where we're unable to access them. One of the therapies we can look at here is dream analysis. And dream analysis is how we can access our unconscious thoughts through analysing our dreams. We then have the positive approach. The positive approach is a relatively new approach. And rather than looking at illnesses, the positive approach wants to focus on what is good about people and encourages people to live in the present rather than worrying about the past or future. It also believes we have the free will to focus on our strengths and make changes to our lives. The therapy we can look at here is mindfulness. You may have heard of mindfulness, and mindfulness is based on Buddhist meditation techniques. Finally, we have the behaviourist approach. The behaviourist approach is all about how behaviour is learnt. And we call this learning conditioning. And this can be learning through association, so making links between two things, such as a study by Pavlov, who looked at how ringing a bell could cause dogs to salivate because they associated that bell ringing with food. Here we can look at different therapies again, so you may be looking at aversion therapy, or you could be looking at treating phobias with systematic desensitization. You'd then be moving on to Unit 2. Unit 2 initially starts with contemporary debates. So these are 5 debates, and each one links to one of the 5 approaches that you looked at in Unit 1. These are all issues that you can explore and are relevant to the real world. So things like, should the mother be the primary caregiver? So maybe we might think of that as something that's outdated, but we can explore that and see whether it is still relevant. Should the mother be the primary caregiver or not? We can also look at things like neuroscience, eyewitness testimony. We then move on to research methods. So research methods are really important because research is still being done today. And when we do our research methods, we will be learning about how we carry out research, how we design our studies, and we'll be using mathematical skills to analyse data. Psychology can be quite a challenging subject, and therefore the grade requirements for this course reflect that. So ideally you would have a grade B or above in English or Welsh. So depending on which language you were hoping to take the course in. And this is really important because of all of the terminology involved in psychology. And there will be extended essay questions in some of the exams. You'd also ideally have a B in maths or numeracy. So this is going to help us with our research methods when we need to analyse our data. And finally, we'd be looking for a B or above in science. So science is clearly going to link with our biological approach and looking at how the brain works. But also you can link to our research methods because it's likely that you've done some kind of experimentation in science. So you may find that that helps you with research methods. So psychology only has exams. There are no coursework elements to this. Unit 1 and 2 in the first year are both written examinations, and they have a mixture of short questions and longer answer questions. Both of the papers are 1 hour and 30 minutes. You will also have exams in the second year, so 2 exams again. In the second year, you will have Unit 3, which is a longer exam. So that's a 2.5 hour exam, where you'll be looking at particular behaviours in more detail. So these could be things like schizophrenia, crime, addiction, stress. So you'll be looking at 3 different behaviours in detail. You'd then move on to Unit 4, which is pretty similar to Unit 2. So you'll be using what you've learnt in Unit 2 to help you in Unit 4. Unit 4 is back down to 1 hour and 30 minutes. And as well as doing those research methods, when you do Unit 4, you will be able to apply your understanding of how to do research and take part in a class study of your own. When you study psychology, you will also learn some transferable skills. So I said that some of the papers involve longer essay questions, so these might be skills that you learn how to answer these questions that you can then apply to other subjects. In particular, you will learn how to evaluate effectively. There is a possibility of trips and visits, and tutors often have good links to universities, and this leads to speakers being able to come in and talk to you about different aspects of the course. Some of you may already be considering a specific career. And a good thing about psychology is it lends itself to a whole range of different jobs. So you could be working in sports as a sports psychologist, counselling, teaching, the police. You might want to do social work or nursing. Psychology is even useful in recruitment, so HR departments find psychology to be a useful degree. So any job related to understanding people is going to find psychology to be a relevant subject. Obviously, some roles will require further study, so you may need to go to university. And roles like being a clinical psychologist, you would need to get a doctorate. So to finish, we will just have a look at a psychological phenomena and see how it can be related to the real world. So in this video, you will need to count how many times the white team passed the ball.
This is an awareness test. How many passes does the team in white make?
Go!
The answer is 13. But did you see the moonwalking bear?
Go!
So most people who watched that video won't notice the dancing bear. Often when people are asked to attend to one task, they focus so strongly on that task that they miss other important details. And we call this selective attention. So this is a concept in psychology, and here in this video, it has been applied to the real world because this is part of a campaign by Transport for London. And they wanted to demonstrate to people how important it is to watch out for cyclists. Because often, as you're driving, you miss them as your attention is elsewhere. You're not thinking about cyclists. You're not trying to watch out for them. So you don't notice them. So if you're interested in learning more about psychology, or you have any further questions, please ask one of your tutors for more information. Thank you very much.